Fall sports season are underway, and unfortunately, they can lead to injuries. Of the 30 million children and teens that participate in sports, 3.5 million get hurt each year. So here to talk about those injuries is Allina Health's sports and orthopedic specialist, Dr. Robby Bershow. Dr. Bershow, thanks for joining us this morning.
Hi, AJ. Thanks for having me.
So let's start with this. How common are sports injuries among children and teens? What are you seeing now?
Yeah, sports injuries are really common. And while we certainly see the most in our high school and collegiate athletes, we are certainly seeing younger and younger patients come in with injuries all the time, especially in those middle school years.
What kind of injuries are we talking about that you're seeing among middle schoolers?
Yeah, a lot of that demographic has not only just the typical sprains and strains that we see from in-athletic participation, but in that group, we also see a lot more in the way of overuse injuries as well. A lot of the times we see these athletes specializing in sports at younger and younger age, and that means they're doing the same thing year round without really having much of a chance for a break or giving their bodies any chance to rest and recover. Is
part of that because kids are still growing at that point, so they just need that time for recovery?
Yeah, part of that is definitely the case. A lot of the times, too, just our bodies are designed to be challenged in different ways and to move in different ways. And so when they're just doing those same motions repetitively, especially with that stress on their growing skeletons, that can be really, really hard for them. And there's a real risk there of not just physical injury, but also burnout as well, which we're seeing a lot more commonly.
You know, one of the things I think a lot of people focus on right now, too, when it comes to sports like soccer or sports like football, would be concussions. Are you seeing an influx of patients coming in that have concussive symptoms?
So concussions are also really common. And I think one good thing that we're seeing is that there's a lot more recognition of concussions out there. And the result of that is people are presenting more and more with those types of injuries. One of the things we would look for there after a hit to the head would be something like headache or fogginess or dizziness. But a lot of the times those symptoms can be really subtle. It's just something that can even be, I'm just not quite feeling right. So when those are present, that is really, really important for us to evaluate and check out.
As a parent, are there things that parents can do to reduce the risk of injury for their students? Or even as a student athlete, what can they do to make sure that they do stay healthy?
Yeah, two big takeaways here for young athletes. First, don't play through pain. Second, give your body a chance to rest and recover. The kids that we see, it's really not common for them to have pain, unlike adults where our bodies might hurt when we're raking or shoveling. Kids shouldn't have pain. And so if that's persisting, especially into the next day, that should get checked out. Also taking about a month or so to really break and do something different with activity, whether that's a different sport, different activity or rest, gives our brain and our body a chance to recover and be challenged in a different way. And that can go a long way towards preventing injury as well.
And that was actually going to be my next question as far as a break period is concerned. How long should a break take place? And you said it's about a month, trying something new or something different?
Yeah, I think realistically, a lot of these sports seasons run at least 12 months a year, or kids have multiple overlapping seasons at the same time. So obviously, there's an amount where we need to be realistic about what they're doing, but really trying to take at least a month off where we're doing something different, and as much as 2 or 3 months can be really helpful. A lot of the times we see that if people are just pushing harder and harder and harder with the same activity, they're actually going to see their performance start to go down, go the other direction. And that can also be that risk of physical injury as well.
All right, something to consider. Hey, Dr. Bershow, thanks for joining us this morning. We appreciate your time.
Great to be here.